Fluoroscopy is an important radiologic imaging technique. It provides real-time imaging of internal body structures. Fluoroscopy is used in minimally invasive surgeries such as catheter and stent placement. It helps place devices such as stents to open blocked arteries and allows doctors to monitor blood flow in real time. It's used in spinal and joint injections, as well as orthopedic surgeries. There are certain advantages to using fluoroscopy. One of those advantages is that it provides real-time feedback, which allows physicians to watch the procedure unfold, as well as making instant adjustments. It's also considered cost-effective and more readily available compared to CT or MRI. With that being said, there are also disadvantages of using fluoroscopy. One of those disadvantages is the increased exposure required for real-time imaging. Prolonged exposure to high doses of radiation may lead to injuries such as burns, hair loss, and in severe cases, tissue necrosis as well as cancer. It also poses a risk for medical staff, even though they're not being hit directly because they're still being exposed to scattered radiation. This increases their risk of health issues like cataracts and certain cancers. There are also special precautions for vulnerable groups such as women and children who are more sensitive to radiation. So typically, fluoroscopy is avoided during pregnancy unless it's absolutely necessary, and special care is taken to minimize radiation dosage for pediatric patients. Even though it's great for real-time visualization, it provides less detailed images of soft tissues compared to MRI and CT. There are also risks associated with contrast agents, such as allergic reactions to the dyes and kidney damage. This is particularly common in patients with pre-existing renal issues. The fluoroscope was invented by Thomas Edison 1 year after William Röntgen discovered X-rays. While doing research for this presentation, I learned that research is happening all the time with the goal of reducing the amount and length of radiation exposure. There are even procedures that doctors are trying to do without the use of ionizing radiation, particularly that use fluoroscopy. There was a study done between January 2017 and March of 2020, with the goal of assessing the results of 248 patients who underwent fluoroscopy-free retrograde intrarenal surgery to treat kidney stones, which concluded that without fluoroscopy, flexible ureterorhinoscopy can be conducted with low risk and a high success rate. There was another study done in February of 2024 to determine if using double C-arm fluoroscopes reduced the amount of ionizing radiation needed to get the images. The study involved 30 patients with femoral neck fractures and divided those patients into single-arm and double-arm groups. The study concluded that using a double arm to shorten the operation time is an effective method for reducing radiation exposure. Although the results of that study seem positive, more research needs to be done on a higher scale to test the consistency of these results. While doctors are trying their best to come up with different methods of reducing exposure time in fluoroscopy procedures, it still plays a vital role in the field of radiology. It is invaluable for its diagnostic capabilities, real-time visualization, and its minimal invasiveness. Fluoroscopy